travelling from across England to march in central London. NHS staff against mandatory vaccination. In just under a fortnight, healthcare workers who haven't yet had their first COVID vaccine face the sack.
I'm a nurse in the NHS. I've got no issue with people having the vaccine, not having the vaccine, but it needs to be a choice. There's not enough evidence behind to back making it mandatory. Anyone that's unvaxxed can still pass it on, and it's our risk. I've worked for 2 years through the pandemic on a COVID ward, where at the beginning we had terrible PPE and we had to risk it and go and work for them. They were clapping us every Thursday, calling us heroes, and now they're saying that if I'm not having this vaccine in my body, I'm going to lose my job.
Similar protests are happening today in Manchester and Birmingham. Research by this programme shows just over 52,000 unvaccinated NHS workers are not thought to have a medical exemption, which means they're at risk of losing their jobs.
I've worked in the NHS for 25 years and I've been a consultant now for about 12 years. And for me, my decision was really set when they enforced it on social care, because I think they really bullied a group of people with the choice of between either getting vaccinated or losing their job. I don't think it's my place to deter people, and it's not my place to particularly promote. So that's how I feel. I mean, I'm not in the front line of vaccinating people, but all I do know is that people have choice. And when we give up choice, we're in a very dangerous place.
Several countries already have vaccine mandates in place for healthcare workers, including France, Italy and New Zealand, and it's soon to be introduced in the US and Germany. The fact that it's now coming to England has aggrieved more than just those it affects.
This process is now huge. It's running all the way down Regent Street in central London, but what started as an anti-mandatory vaccination for NHS workers has now grown into something much broader, an anti-vax march in general.
Despite the Prime Minister promising to reflect on the way ahead in Parliament this week, the government told us today that they had no plans on changing the date for compulsory vaccines. NHS leaders say staff have a duty to protect those they care for.
If you're marching today, just take a moment, think about the people that you've been looking after who have experienced COVID, think about your colleagues who you've been working with, and think about the best way to make sure that we're all protected and that we're all as safe as possible, because we are very much in this together and it's down to us to look after each other too.
There's lots at stake for both sides of the NHS vaccine policy. The government can't afford to lose tens of thousands of experienced workers, and many staff can't afford to lose their jobs. Yet 12 days before this looming cut-off date, and neither side showing any sign of changing course.
Well, a little earlier I spoke to Dr. David Nicholl, a consultant neurologist based in Birmingham, and Helen Donovan of the Royal College of Nursing. I began by asking Helen Donovan what her concerns were about the government's policy.
I don't agree, and the ERCN doesn't agree with mandatory vaccination, but actually all staff and all of our members should get vaccinated. These vaccines are safe, they're effective, they're proving to be slowing down the rates of hospital admissions and serious disease. So fundamentally, everybody should get the vaccine, but making it mandatory actually put some barriers in place when you're trying to support people who have concerns, who have hesitancy. I don't agree with mandatory vaccination, but actually what we're asking for at the moment is a pause, because we cannot afford to lose any staff at the moment, given the pressures that the health service and wider health services are facing at the moment.
And just to be clear, you're not an anti-vaxxer, you're not anti-vaccination in any way?
Absolutely not. I've been an immunisation nurse specialist for, I don't know, more years than I care to think about. So, and most members and most nursing staff have had the vaccine. We're talking about a very, very small number, but it's a significant number when you're looking at the crisis and the pressures that the NHS are under at the moment.
David Nicholl, you're only going to be able to persuade a certain amount of people. There are going to be people who remain reluctant, some of whom work in the NHS. What sort of danger does that pose?
The best thing to do is to get vaccinated. And I've done a lot of work on hospital-acquired COVID. And, we would be in a much worse position, if you think back to where we were at the beginning. So please, I can't emphasise enough importance of getting vaccinated. But I think that, I think Sajid Javid is going to have to do some kind of U-turn because of this staffing risk. One alternative would be more regular testing. Should we say that those people aren't vaccinated, you have to do that, you have to be tested, lateral flow every day, or high-strength PPE. But whatever happens, there's going to be massive legal arguments with this. So I don't want anyone to be under any illusion the most important thing to do is to get vaccinated. But I think I can see that there's going to be some kind of delay is going to be required because of the staffing issues.
What kind of staffing issues we're looking at? I mean, how many nurses could leave the profession?
Well, based on the government's own figures, we're looking at about 73,000 staff could face being dismissed if this goes ahead. We're waiting for government to come out with exact figures. We know from the data that over 90% of staff across the country have been vaccinated. I think the concern for us is that we came into this pandemic with around 40,000 nursing vacancies in England alone, and facing additional cuts and additional loss of staff with this measure just puts unimaginable pressure even further.
But the reason the government is looking at making it mandatory is because of patient safety. We do know that unvaccinated people are more likely to spread COVID. Many of us would be worried if we were being treated by people who hadn't been vaccinated. That's a legitimate worry, isn't it?
Well, it is, and we know that the vaccines work, but their prime aim and their prime role is in stopping people getting serious infection. So in terms of staff, it's about stopping sickness as well as stopping people getting infection that they can pass on. So I think it is too simplistic to say that those staff who haven't been vaccinated are a bigger risk. Although, as Dr. Nicholl said, I think there is a responsibility for everybody to make sure that they are following the guidance in their local organisations around testing, and certainly wearing and using the most appropriate PPE.
I mean, there are other jobs where you have to have certain requirements in order to do that job. For instance, a job that requires driving, you need a driving licence. So why is this so different to say, if you want to work in the NHS, you have to have a vaccination?
Well, it's much easier for staff that are starting. Okay, this is why this does become a bit of a legal nightmare. So, for new starters, it's much easier. It's when people are already in position, and maybe we just need to have a debate. That's actually, well, I know you got strong views, but actually, I know a lot of people that got vaccinated and they're not in ITU and dead. And in fact, personally, the only member of my family who wasn't vaccinated was the one who died of COVID last year. So, for me, it is personal.
So, Helen Donoghue, what is your message to Sajid Javid, the Health Secretary?
Well, we would say, pause this. Let us have more time. We cannot afford to lose any members of staff at the moment, and we need to be having those conversations with those members of staff who haven't had the vaccine. We need the staff that we've got. We cannot do anything at the moment that jeopardises that.